We have the advent of a very promising and radically different technology for delivering interventional care that our field must cope with. And there's tremendous promise but substantial challenges. And this is being able to perform interventions by not having the interventionalist standing next to the arterial puncture site and using their hands directly to control the catheter, but instead using a robotic control over the catheter with the interventionalist moving joysticks. And this means the interventionalist can be out of the room. Not only that, they could be in a different city and provide care remotely. So this really very different potential means of delivering care raises ethical aspects that we all need to think about in four different domains: the ethics of remote care, of not being with the patient when you deliver therapy; the ethics of new surgical techniques and training that apply to any new surgical advance; the specific ethics of robotic-assisted procedures; and in the future, the ethics of autonomous artificial intelligence robotic care, where some of the interventions are done by software with physician supervision or even without physician supervision. So it's in that interesting but complex ethical domain that it will be helpful for us to think through the best framework for developing this new technology. With regard to the informed consent and respect of patient autonomy, we have several challenges here. First, patients may not be aware that they are receiving a completely new type of therapy, and for there, of course, the answer is to be sure to disclose this. Another is that the evidence of the risks and benefits of this innovative surgical approach are not available because it hasn't been done to any great extent in people before. And again, disclosure is the best approach. There's also a general tendency among patients to equate newness with increased benefit. And that's, as we know, not always the case. And so we have to counter that by in our discussions with their patient. And then finally, there's the natural tendency to trust in the authority of the interventionalist. And interventionalists certainly need confidence when they're doing procedures, but they also have to have humility about their capabilities in so new an area where everyone is unpracticed, and be willing to share the limitations that they know they are facing when they undertake this intervention.